Hello everyone, my name is Kai Wilkinson. Today I'm going to be reflecting on my overall internship experience this summer. My summer internship lasted from May to July of this year, 2025, and the outpatient physical therapy clinic that I chose to do my internship at was Diamondback Physical Therapy. Diamondback Physical Therapy is located in Gilbert, Arizona, and is run by Wid Workman, who started Diamondback Physical Therapy in 2008, and he also has his brother employed there, Win Workman, who is another doctor of physical therapy. I have known about Diamondback Physical Therapy for a few years now, and also have known Win and Wid Workman for a few years as well. I was able to contact them and be able to get a chance to do my shadowing and internship hours at Diamondback Physical Therapy, and gained around 153 hours this summer being able to observe the different physical therapists as well as the PTAs that worked there, but mainly go through what it means to be a physical therapist. Some of my goals this summer were to develop some more confidence in a clinical setting and develop more knowledge of why they do things the way they do in a clinical setting. Being able to see real world people and see the way that the therapists will face challenges on real people, not just a case file that I can look over for days, but a person that has needs that are needing to be filled and how to help them. And Win and Wid were fantastic teachers in showing me how I can do that. My main objectives for this summer were to, of course, gain some more skills in a clinical setting, whether that's modalities, exercises, any of the above, but also be able to work on my ability in patient interaction and be able to have a conversation with them about how they're feeling and be able to not only create a good environment for them and make them enjoy coming to physical therapy, but also to be able to get proper documentation, be able to relay exactly how that person is feeling and how the therapist might be able to change what they've been doing, or even better, get good news that everything that they are doing is working and to stay on that track. Another learning objective I had this summer was to really focus on documentation and get an idea of how insurance is run in a clinical setting. Insurance, in a hilarious quote told to me many a time over the summer, is you don't document, you don't get paid, which isn't necessarily hilarious when it's actually very true. But being able to learn on how to take that proper documentation, how to be able to accurately and correctly document the way a patient is feeling, the needs of the patient, how their body is responding to exercises. And a lot of time was spent filling out SOAP notes, or at least seeing the way that the therapists would fill out the SOAP notes. And then another key learning objective for me this summer was being able to take my knowledge of therapeutic exercises and modalities and be able to apply them a little more. Be able to see how I can differentiate on why we should or should not do a certain therapeutic exercise, or why we should or should not do a certain therapeutic modality, when, even though it may make sense for me with the limited knowledge that I have gained so far as to why it might not make sense or why it might not be the best idea. And I wanted to gain some more insight from physical therapists that have been practicing for a while, and be able to see how their brain thinks and see how they go about patient progressions, and how to determine whether they should or should not change up a plan for for a patient's care and for their exercises. Kind of going into a little more of the patient interaction and the documentation is that one of the major things that I learned about physical therapy, being a physical therapist, and allowing people to have a good time at physical therapy, be able to enjoy it, be able to trust it, was almost completely reliant on building a good environment for the patients. Being able to show them how to be motivated when doing their exercises. As someone who has been through PT multiple times, one for a post-operation, it can be difficult to be able to make it down that long road of recovery, or be able to feel like you're where you used to be. And being able to help build that good environment, being able to help people along the path of recovery was such an eye-opening moment for me this summer. It's definitely something that, again, I've experienced myself, but never entirely thought about the importance of the therapists pushing me along, trying to keep me motivated, building a good environment for me. And I feel that I gained a deeper appreciation for that. And being able to take into account what people are actually saying, not just being another ear for them to talk into, not only helped me build a good relationship with many of the consistent patients and help them stay motivated and continue along their long road of recovery, but also helped me a ton in proper documentation for patients. Being able to see that documentation, be able to go more in depth on the importance of it, allowed me to see more about how it's so important to a patient's overall care, but also is important for legal reasons and for billing, and for any sort of billing that is necessary for patients to continue to be able to come to physical therapy and improve each day, as not having proper documentation can lead insurance companies to not allow any more visits, or saying that they won't pay for any more visits, which for many people is a necessity coming to physical therapy. There are a lot of times that physical therapy can get expensive after a lot of visits, especially for those that really need a few weeks, a few months coming in. It's difficult to be able to financially pay for all of that at times. But the proper documentation was able to allow more patients to continue coming and not have any legal issues, and again, any billing issues with insurance companies. There were many times that the PTs would have me sit down and go over what's a bad example of documentation and what's a good example of documentation. Properly having everything you did, your rationale for why you did that, was key factors that they wanted me to focus on. And going over SOAP notes again with that documentation, the patient's subjective, the objective, their assessment on that day for the physical therapist, and their plan for that patient. And a lot of times, the 12 visits that are normal for insurance companies to give out for patients isn't enough visits for them to be properly treated and be able to gain a benefit, especially for those that have been in rough car accidents that take a few months to heal. And especially at 2 to 3 visits a week, which is the standard visit amount, it's difficult to be able to get enough time with the physical therapist doing all the exercises, being able to get those proper progressions without more visits. And so, as I said, that was a big factor for me this summer, was learning more about documentation and going more into depth about the real world importance of it. This summer, one of the big things that the therapist also had me focus on was the therapeutic exercises for each and every patient. Going over, are they doing them right? Is their form correct? Is it actually doing any benefit anymore? Is it too easy? Is it too hard? Do we need to hold on it for today? Is it causing too much issues? Many other factors like those. And that was one of the challenges that I had going into this summer internship, was learning how to properly progress a patient, knowing when in a real world example was it a good time to progress for a patient. And over the summer, there were a lot of times I would discuss with the physical therapist about, are they ready to progress or are they not ready to progress? And a little bit more than I was expecting, there was a lot of times that patients wouldn't progress for a whole week or two. But then on the other hand, there was a lot of patients that they were very on top of exercises at home and stretches, and were in fact very ahead of schedule as far as the physical therapists were planning on them being, and would have to make adjustments. And sometimes those adjustments would only last 2 or 3 visits, and then more adjustments would have to be made. So that was one of the biggest challenges for me, was properly learning about it. And this summer, with the help of the physical therapists that I worked with, it was very influential for me to be able to learn a little more and kind of see those examples of people that aren't ready to progress, but also see examples of people that are very much ready to progress and could gain a lot of benefit from those progressions. A couple of the other challenges that I really faced this summer were getting used to the more of the terminology that physical therapists would use, mainly with exercises that they were giving to them, or in many times they know that I'm a student wanting to go into physical therapy, and a lot of times would test me on my ability to retain any knowledge that they had given me, as far as anatomy wise or any other types of terminology that they would use in their physical therapist setting. And for the first couple of weeks, it was really difficult to be able to fully understand and comprehend exactly what they were trying to instill in me and get me to understand and learn. But as the summer went on, I was able to get a lot more comfortable with the terminology that they would use. And with that, I felt a lot more confidence in anatomical knowledge that I had wanted to focus on being able to apply in a clinical setting and use in a real world setting, and felt like with the help of that terminology in a clinical setting, I was able to also build upon my confidence in not only the anatomical knowledge, but also therapeutic exercises, what are focuses, and being able to apply knowledge that I felt like I had already known, but had difficulty with actually utilizing it. And the other thing that I really struggled with becoming a physical therapist was, or with wanting to become a physical therapist, was trying to understand time management. That was a heavy focus on busy days. There were days where the therapist said, I want you to go around, do exercises with patients, but he said, I want you to focus on how I go about the day. And it would be a very quick patient to patient to patient to patient, trying to stay on top of things, either getting patients before they were done with their exercises or waiting until the end so that the patient would, so that they could time out things better. He always took into account whether he was working on multiple areas of the body, whether it was just one area that wouldn't take as much time, how large is the area, what is the actual treatment that I have to do, do I have to do dry needling, cupping. He would take all of that into effect and was able to teach me in a very effective way how to properly time manage. And I feel it's a skill that I still need to understand a little more, but feel that I have much more understanding and more of an idea of how to time manage better as a physical therapist and in a clinical setting than I previously ever had. Over the summer, I was really able to solidify my desire to be a physical therapist. I have gone to school for 3 years now for my undergrad and have done nothing but think about wanting to get into PT school and become a physical therapist, but being able to actually be in a clinical setting and be with the physical therapists, see how they interact with patients, how they were able to help patients, was really just an eye opener for me and helped me realize even more that I wanted to be a physical therapist, that I want to be able to help people and want to be able to do what I can for people around me. And I'm excited for physical therapy and excited to learn a little bit more about the nitty-gritty details about physical therapy and hope to be in more clinical settings in the future. And a lot of the lessons I've learned this summer with Wynn and Wid Workman at Diamondback has been nothing short of incredible. And I feel I've learned a lot of skills that I will be able to take with me into physical therapy school and will allow me to hopefully one day successfully become a effective physical therapist that is able to help as many people as I can each and every day.